everyone. Before we break, we heard Nicole's breast cancer story. She's still here with us in the audience. But now we're going to talk about breast reconstruction options available for survivors, because there are a few. Joining us are Dr. Somogyi and Dr. Jalil, the founders of Forms, Face and Body, a plastic surgery clinic that specializes in reconstructive surgery. So, doctors, we just heard from Nicole that she had delayed reconstruction, but immediate reconstruction is possible. So walk us through, not everyone knows this, walk us through the pros and cons and what goes into that decision.
So that's a really excellent question. I should start off by saying that we always attempt 100% of the time to make immediate reconstruction available in all of our patients. And that's really, if you look at all the medical studies, the data, it's really supportive in that. And that's because of the immediate measures of quality of life that improves in patients that proceed with immediate reconstruction. Could be things like going to the beach, could be things like fitting that dress for a wedding, or even just something simple and having that sense of femininity restored. And conversely, sometimes breast cancer care is really a focus. And if a patient comes in with a more advanced form of breast cancer, then the focus is kind of shifted, and we as reconstructive surgeons have to take a back seat. And so we always encourage patients to come back after their cancer has been cleared and they're disease-free to entertain delayed reconstruction. There's still pros to that. People oftentimes are in a better headspace. They feel like they're disease-free. They feel like they're ready to take this journey on. And then also, more importantly, it's an elective surgery, so they can use that timeline to fit around work events, schooling, or anything related to the kids.
Good. Okay. Now, what goes into the decision?
Yeah, I mean, you can imagine the decision being incredibly difficult for a woman that's just been diagnosed with breast cancer to now decide, learn all about the treatment, learn about reconstruction, think about what life is going to be like after. And traditionally, that decision was made by the patient going to all of the different providers, surgeons, the medical oncologist, radiation doctor, all these different people, and then I guess sitting at home and trying to figure out how to make that decision, and it's a really tough one. You know, things have really changed, really for the positive now, where we have this multidisciplinary approach to looking after breast cancer. So today, in centers like ours in Toronto, where we look after a lot of breast cancer patients, we sit with all of those other doctors and discuss every case. So, and we do that with the patient present in many cases. And so all of the information is provided at the same time so that patients can weigh the pros and cons, ask their questions, and make a decision that really fits, you know, their life and, of course, their cancer.
Yeah, there's so much information coming at you and in such a tiny time frame to make these decisions. That makes a lot of sense. So the options for breast reconstruction have definitely come a long way. Nicole went through DIEP flap reconstruction. Can you explain what that is? How that works?
Yeah, so we as plastic surgeons think of ourselves as creative and artistic types. So we're always looking for different areas of the body that we can use and create something amazing. More commonly, we always select the area of the lower abdomen where there's a little bit of excess skin and tissue.
Says who?
Sometimes.
Prove it.
So we take that tissue and we mold and we sculpt and we create a new breast out of it. Now, it doesn't happen by magic. We still have to use a surgical technique called microsurgery. And usually with that tissue that we do transfer up to the chest, it comes with a tiny little blood vessel. And that's where the microscope comes in and the magic happens, where we connect it underneath the microscope to bring it back to life.
How long has that been going on for, that surgery?
It's been going on for quite a bit. It's advanced every single year.
Yeah.
It used to be called a tram flap. Now it's called a DIEP flap. And the DIEP flap's been popularized for about 10 to 15 years. Okay.
So from a surgeon and patient's perspective, what makes this a good or not so great option?
So again, complicated, but we nowadays try to put those two things together in front of the patient. So the surgeons will talk about things like how aggressive the cancer is, or what other treatments that patient might need. Do they need radiation? Do they need chemotherapy? What's the timeline for that? So those are the things that we're really concerned about. But we bring the patient in because we need to know, you know, what kind of person are they? What's important to them in terms of their lives? How much recovery time can they tolerate? Does it fit within their sort of overall goals? I mean, some people are, you know, one and done, let's get this over with people, and some people realize that this is a journey and want to take it slow. So it's all of those things together to make that decision.
Okay, so Nicole, over to you. Why were you interested in this option?
I think I felt using my own tissue was important to me. The one and done of the surgery, where other surgeries are multiple surgeries, and the added benefit of the tummy tuck too was a plus too.
And that's why Nicole was saying earlier, you're back to like pre-baby body almost, so you're feeling really good about that situation as well. So DIEP flap isn't the only option. Can you walk us through implants? Because implants, I think, is what most of us know, and what patients might decide, why they might decide to go that route.
Of course, it's a super important form of reconstruction, and even in North America, it's still the one that's the most predominant.
Yeah.
And so with implant-based reconstruction, many patients like it because it does get them back up to normal faster. They're able to resume their activities a bit more normally. With DIEP flap, as you can tell, there's 2 sites to recover from. With an implant, there's generally just 1 site to recover from. Now, there is nuance to it. Sometimes if there are other things that we have to battle, like radiation, we have to add on a procedure such as a latissimus flap, but thankfully that's rare, and so oftentimes the recovery is a bit more straightforward.
Okay, all right. And the risks for both, like about the same? Like, are there any, like a harder recovery, I guess, for if you're getting the DIEP flap versus the implants, but do either of them have increased risk to your health?
No, they typically are very safe options, but there are more nuances with regards to risk, because with implant risk, there's going to be a whole different set of complications, as opposed to with the DIEP flap, it's going to be a different set.
Got it, for sure. Okay, let's talk about access to breast reconstruction. Is this something readily available to all Canadians? Can we all access it?
Yeah, so available and access are a little bit different, of course. Thankfully, with all the work that surgeons, even before us and things like this, and women's groups and breast cancer societies, we've advanced to the point where, these surgeries, these procedures are covered by our healthcare system, which is amazing, across the country. And there are a lot of surgeons that are trained to do this kind of work in different places. The issue really is access. These are resource-intensive surgeries. If we need implants, those are expensive. Other materials that we use, microsurgery, like Dr. Jalil talked about with DIEP flaps, need microscopes and specialized training and recovery areas. So, these are resource intensive, and that can be difficult outside of major centers. And so, access in major centers pretty good, much better than it used to be. But what we really need is access across the country to everybody. It's actually mandated now that every woman that has a breast cancer diagnosis gets the opportunity to discuss reconstruction before surgery. So at least they can make that educated decision. That's super important, very important first step.
Thank you, doctors. Nicole, do you have any advice for women that are in a similar position that you've been in?
For sure. As the doctor said, education, get to know your options, seek out, discussion boards, support groups. I had a wonderful support group, women that had gone through it before me, but if you don't, get the information, multiple referrals if you have to, if you're not comfortable with one opinion, but definitely advocate for yourself.
And find yourself a husband who's good being on camera with you in the front row. Thank you, Hubs. So nice. Thank you for all of the information. Thank you, doctors. For more information on breast reconstruction, visit our website, cityline.tv. We're going to break. Stay with us.